Hi, this is Dr. Dhanashekhar in SS Childcare channel again, and today we're going to talk about bathing or bathing in kids. And it's very important because of course, I'm sat with a towel here and you might wonder why, and that's the reason why I'm here. So when you talk about bathing in kids, it's very important to understand how nature or God, whomever you believe, has created is that in the skin of newborn babies, there's something very waxy by the name called vernix. Now, what does vernix do? Vernix is basically a buttery substance on the skin that actually helps to keep the skin moist, because when the baby is inside the mother's womb, it has to be protected from the amniotic fluid and all the other things surrounding it, so the skin is remain intact. After birth, when you notice, a lot of babies in India especially are given treatments which are with irritants. So the commonly used things are neem, turmeric and different kind of powders that are prepared at home with different dals which are used for cooking, where the skin is actually rubbed with these things to remove the layer of the moisture that is there existent already. Vernix, when it's treated gently, can remain on the skin for about 45 to 60 days, which will preserve the skin's moisture and architecture. Now, this is basically spoiled by external agents like people who come. There might be a nanny who might come home to give bath to the kids, where the child is continuously battered on the leg, where the child can have a pat on the back, on the front, and even the nanny puts the finger inside the mouth to clean the child's tongue. And more importantly, or worse than that, your unvaccinated nanny for COVID or for any infection actually puts her mouth on the child's face and blows into the nose to clear all the secretions of the nose and mouth. But interestingly, a lot of channels in YouTube which I've actually seen over the last few days to try and get an understanding, people are so proud to show how they bathe their babies, and it's interesting to watch that there are a lot of people from the Western world who are shocked by seeing the practice in India, saying that this is totally atrocious, and I think I should second that, because it's very important that we know what we're doing is not the right thing to do. So bathing should actually be a very comfortable and a good experience. So normally we would say you can bathe the child twice a week, wash the head, and everyday bathing is perfectly fine, and you can do it once in the morning and once at night time. Night time preferably before dinner. The only reason is because if you feed the child and bathe, if the child chokes or aspirates, they can vomit everything, and that's the reason why we don't do it. So coming to the skin part, it's very important to understand the nature's design. If you look at your hand, this part of your body is an extra ultra sensitive area. Now, if you're going to bathe your baby, or if you're going to even feed your baby formula milk, and if you want to check if the temperature suits the child, it's very important that you can pour a drop of water just here to try and see if it is hot or cold. If it's too hot, of course, it is going to be hot for the baby. If it is going to be too cold, it's going to be cold for the baby as well. So it's very important that we try and avoid the extremes of temperature. You don't need a thermometer to do it. Your mind and your hand works together, and that's perfectly fine. Now coming to the next part, what baby wash or soap do we use? You can use anything of your choice. Any baby wash or soap is perfectly fine. The reason is because it does not dry the skin. And the skin pH is basically something that has to be maintained, and that is the reason why we would advise using a baby wash and nothing else. And what do you do after a bath? It's very important, because when you use a towel, the towel tells a lot about yourself. So you need to use a separate towel for the baby, and that has to be only used for the child and not for any other purpose. And what we do is, after a bath, the skin has to be damped. Damp dry is what we call. But a lot of households, what they do is they actually rub the skin of the baby and make the skin even dry and worse. That is a very bad thing to do. So generally speaking, what we should advise, or what doctors advise, is to use moisturizing cream thrice a day, minimum 3 times, morning, afternoon, night time, and 3 to 5 minutes after a bath is very important. Now, it's also imperative to understand that if you cannot do it 3 times a day, the moisturizing cream application, twice is okay, or minimum even once is perfectly fine. And that is going to maintain the skin complexion and reduce external damage to changing weather and temperature. I generally see a lot of mothers are quite excited about looking after the baby in the first 2 years of life. But what happens after the second year of life is most of the children don't get the same treatment, the same care and attention with specificities, and that's basically changes over a period of 2 years. Then the skin kind of loses its texture. And that's the reason why the complexion changes in babies when they are little toddlers to infants to older children, and it's extremely important. Coming to the moisturizing lotion part, I tell that you can actually apply moisturizing lotion on the face as well. And they ask, sir, it says skin lotion. Of course, the face is also skin, and you need to understand moisturizing lotion should be applied from head to feet. So bath should be a pleasurable experience, and it should be something where there is good connection emotionally between the child and the mother, and also even if it's a granddad or grandmom who's involved, it has to happen so that the child looks forward to it. And also there are certain things that are available in the market, like bathing devices like these. I don't know what brand this is, but it's very important that you can use things like these where the baby can actually be kept. See, if you keep this on the table or on the floor, it has got suction cups which are very safe for the child. You keep the child here, make the child lie down, give the child a good wash, dab the skin dry, apply moisturizing lotion, and that's basically how it works. And this, of course, can be an activity as well as a child grows on, and something that you will enjoy with time. Although there are a lot of videos on YouTube about bath and bathing, I thought it's very important to shed some scientific light and advice on this topic, and hence the reason for discussing it today. I hope you enjoyed it and keep watching it. Please do like the videos and subscribe to them and write your comments down, and those comments will keep me motivated to come back to you with more topics in the future for interest and for scientific discussion. It's very important that our channel only discusses science and demystifies a lot of myths which are in young parents' mind. Thank you once again, and we'll meet again, and I look forward to meeting you.